I've decided that court cases are not going to hold us back. There are some other things we are doing because we are determined, because the Constitution tells us it's a right of Kenyans to have accessible to affordable health care. And once the law of affordable health care is passed by Parliament, Kenyans can take government to court for not giving them access to affordable health care. So as Minister for Medical Services, my responsibility to make sure that we are ahead so that no Kenyans take us to court for not doing that by putting in place this social health insurance. Well, Kenyans must realize that this scheme is not for me. It is for Kenyans. And if there are some private organizations who want to delay it, it's for Kenyans to say no. You see, I mean, I will stop being a minister in a couple of months. But when I leave, Kenyans will still be going to hospitals looking for treatment. If they don't have the money to be treated, they will die. So LSK, COTU, and so on, going to court and stopping us from implementing this scheme are just doing a disservice to Kenyans. So it's not for me to plead with LSK not to do that. It's for Kenyans to say, look, why are you doing this to us? It's for the media to shout, because sometimes I feel the media enjoy these court battles, but people in the media can also fall sick. And I don't think people in the media are millionaires who, if they have cancer, they will go to Massachusetts General Hospital to be treated. You better struggle to have those cancer facilities here so that when you are sick, you have an insurance and a facility you can go to. And this is what we are pleading for. And it's not a drama. It's a real life struggle. Now people ask, how is NHIF going to manage it, given so many Kenyans? It is called risk pooling. When you pool the money of all the people earning 1,000 shillings, 6,000 shillings, who pay 150 shillings a month, it's a lot of money. When you pool the money of people who earn 100,000 shillings and above, they're not so that many. Sorry. And the money may not be that much. But put together, it's a lot of money. The second thing is, when you pull this thing together, not all these people are going to fall sick at the same time. Some may fall sick this year, some in 6 years' time. So that if, let's say, 50 people fall sick with cancer, they can draw from this pool without finishing the money. Now, it is important to understand that a national social health insurance scheme is much safer to the person insured because it's a big fund which cannot go bankrupt if properly managed. A small private healthcare insurance scheme can easily go bankrupt, like Mediplus did some years ago. Because when they get too many claims and the pool is not very big, they find they cannot afford it. And they may easily try to diversify their risks by investing in other things. In 2005, what happened is that we took a bill to Parliament which said that Treasury must put aside so much money every year to support NHIF. This time we said no. This time what we said is that let us use the act that established NHIF, which gives NHIF powers to increase the rates that contributors pay and the manner in which these contributors pay this rate, so that NHIF can have sufficient resources to deliver these services. And the actuarial firm that advised us found that if NHIF moves from a flat rate to a graduated rate, it will raise substantial resources to improve service delivery. The only thing that government will come in and help is for paying for indigents. In other words, people are too poor to pay anything per month. Now, already in the ministry, we have developed mechanisms for identifying who the indigents are. For example, we have this program in the rural areas where women are given certificates or vouchers so that when they go to deliver, rather than get money from their pocket, they use these vouchers. Now, that voucher system, the way it was arrived at, was to develop an instrument for identifying income capacity of rural dwellers, so that you identify those who are not capable of paying anything and you give them vouchers. NHIF is going to be a comprehensive social health insurance. In other words, not an insurance scheme which has exceptions, which say, if you're just suffering from HIV/AIDS, we don't cover. If you have cancer, we don't cover. If you have renal failure, we don't cover. No. It will be comprehensive social health coverage.